Good morning, all. My name is Dr. Emajonite Etienne. Welcome to the 2026 Rutgers Online Learning Conference. Today's workshop is titled Supporting Children with Autism, Visual Supports and Positive Behavior Supports, or PBS. Again, my name is Dr. Emajonite Etienne. I am an educational consultant with Etienne Enrichment LLC, which is my organization. A little about me. Again, my name is Dr. Emajonite Etienne. I am an educational consultant with Etienne Enrichment LLC. I am a current preschool special education self-contained teacher. I'm a former developmental interventionist and ABA therapist. My experiences with those roles were with the early intervention system in various private agencies where I provided therapy to children diagnosed with autism or developmental delays. I have over 13 years of experience, probably more, working with adults and children with autism and developmental delays. I am fluent in Haitian Creole, which is something else I help organizations with as far as translations and educational interpretations for Haitian Creole, and I am a former professor. So our agenda and objectives for today, by the end of this workshop, you will be able to identify how visual supports and PBS, or positive behavior supports, improve outcomes for children with autism. We'll select and discuss how to implement effective visual supports across routines and settings and apply positive behavior support strategies to proactively reduce some challenging behaviors that individuals, teachers, parents, providers can experience for children with autism. To get us started, so some foundations. We need to understand the why. So we'll briefly discuss autism, behavior, and communication. So autism as a neurological difference. We need to view autism as a neurological difference, not a behavior problem. All behavior serves as communication. What are children trying to tell us when we see some behaviors that could be described as maladaptive? Because behaviors could be positive, negative, anything a child does can serve as behavior. If it could be observed, seen, measured, it's behavior. We're going to discuss why predictability, structure, and visuals reduce anxiety and escalation that we might see in children with autism, and how PBS, or positive behavior supports, aligns with trauma-informed and inclusive practices. So autism is a neurological difference that impacts how individuals process information, communicate, and experience the world. When we view autism through a deficit or behavior-only lens, we risk responding with punishment instead of support. Many behaviors we see are not intentional misbehavior, which I just described. They are the result of probably an unmet need, a sensory overload, or communication barriers or anxiety that the child with autism might be facing. Again, every behavior communicates something, especially for children with limited or emerging communication skills. Behaviors may be saying, I don't understand. This is too hard. This is overwhelming, or I need help regulating. Many children with autism experience anxiety when expectations are unclear or when their routines change unexpectedly. So that is the reason that I encourage the use of visual supports, and we'll discuss that more in the following slides. Predictability and structure help reduce anxiety by making the environment more understandable for children with autism. PBS focuses on teaching skills, reinforcing positive behavior, and preventing challenges rather than reacting with punishment. And by punishment, I mean like a consequence that follows that behavior. So visual supports that actually work. Visual supports for engagement and independence. And I'll explain what these visuals are in a second. So visual supports give children concrete reminders of expectation. Visuals help with problem solving. Visuals help with communicating needs and wants. Visuals give a cue of what to do or what is happening. So, how do visuals help? They enhance communication for students with autism. Many students with ASD or autism experience difficulties with verbal communication. So, visuals such as pictures that you see here, which is a first, then, and I believe, a visual schedule. Again, I'll explain these in detail. They provide an alternative and concrete way for children to express themselves, understand information, and communicate their needs and preferences. Promotion of predictability and routine. Children with autism often thrive on routine and predictability. So these visual supports help create visual schedules, social stories, offering a visual roadmap of daily activities. This again can reduce anxiety and help the child with autism understand and anticipate transitions and change in routine. So facilitation and understanding and comprehension. That's another benefit of visual supports. Visual aids or supports break down information into manageable, concrete components for the child with autism to understand. Visual supports can be particularly beneficial for academic tasks, social interactions, and most importantly, following instructions at home, at school, and within the community. Why do visuals supports work? They help with transitions and behavior management. They support independence by allowing children to follow simple steps. Like this visual support here on the screen, it's pictures, it shows safe hands, gentle feet, the word stop. And what I've seen in my experience, children with autism, they sometimes associate stop with this stop sign. So I know in my class, when my students see the big red stop sign, they automatically know. Those who are verbal will say stop, and those who I've taught gestures to will say stop, or they'll show me the sign for stop. So I love that. Stop. It tells students to keep a quiet voice, walk in line. So these visuals, even those who don't have language yet or still developing language, they'll see this picture and they'll know, I have an idea of what I should be doing. So why do visuals work? Visuals reduce anxiety by setting clear expectations for children with autism. They help with transitions, which is great for home, school, and community. And they support independence by allowing the child to follow steps on their own. Again, that last part, following steps, of course, we're going to teach how to use these visuals, teach the child what they mean, and with consistency, with structure, the child will automatically know, what to do when they see this visual. So here on the screen, you'll see different types or common types of visual supports. Those I've used within my practice, within my classroom, in the community, at home. So some visual supports, a very important or very beneficial one that I've used is a first then, which is this one here with the yellow and green that says first and then. A choice board will down here asking the child, what do you want? Or show me or point to, that's how you would use that. And the child will pick what they want. Choice boards, visual rules, letting the child know what to do. There's one on the screen that says nice sitting. So for this one, I recommend actually taking a real picture of the child to show them what does nice sitting look like. And I can see myself in the picture. folding hands in lap, sit on bedroom. It says sit on bottom. I'm so sorry. The screen is very small. Hands in lap and quiet voice. But you can vary these directions however you want them. And again, I recommend placing a real photo of the child actually sitting how you want the expectation to be met. Transition cues. Visuals for transitions are very important, letting the child knows what's happening next. So some best practices is to keep your visuals simple, keep them consistent, keep them portable. It does not need to be a big giant poster unless that poster maybe in the classroom or at home will stay in one area. But for me in my class, my visuals are portable because my visuals are also individualized for that child. Those who need reminders for sitting or safe hands or calm body, those visuals are small and it's specific for that individual child. Use visuals proactively, not only during challenging moments. Again, it needs to be embedded in that child's schedule. Pair visuals with spoken language, not instead of. So if I'm asking the child to sit and I'm using the visual, I'm actually holding the visual and I'm pointing, sit, show me nice sitting, and I have the visual, but I'm also pairing it with language. Fade adult prompting, not visual. So you can fade your voice, you can fade the gestures, but not the visuals. Always use them because, again, these changes will not happen overnight. And one key takeaway is visuals increase independence. It helps reduce frustration for that child with autism and supports all learners, not just students with ASD. So visuals can be used in the general education classroom, in inclusive spaces within the community for neurotypical and neurodiverse children. Next, we're going to discuss positive behavior supports, or PBS, in action. Just a reminder, all behavior is communication. So always keep that in mind when we're discussing positive behavior supports. I see my hand raised. My apologies. I don't want to interfere with our, I'm going to try to lower my hand. I don't know how that happened. And I don't see where to lower my hand. So ignore my hand that's raised. My apologies. I don't want to mess up the flow of our presentation here. So positive behavior supports in action. We're going to use data and observation, not assumptions, teach expected behaviors explicitly, reinforce positive behaviors intentionally, modify the environment before reacting to behavior. So effective behavior supports starts with what we can see, not what we assume. Data can be as simple as noting when a behavior occurs or how often or when it's occurring, what happens right before, and how the adult, the teacher, or the parent responds. We cannot assume children know what appropriate behavior looks like, especially students with autism. Reinforcement should be purposeful and meaningful to the child. When we notice and reinforce positive behaviors consistently, we increase the likelihood of what those behaviors will happen again. Before responding to challenging behavior, we should ask what environmental changes could prevent it. So it could always be something environmental. So keep that in mind. 4 steps to PBS, or positive behavior support. We're going to first define the problem behavior, the maladaptive behavior. What do we want to change, or what do we want to decrease or fade away or replace? Identify the function of that behavior. Why is that behavior occurring? Again, all behavior is a communication. We're going to try to determine What is the functioning? What is the why? Develop a plan to change the behavior and implement the plan and evaluate if it's working. And this will take patience. Again, you may need to go back and see what's happening. Ensure that we're observing, taking data, and seeing if the plan needs to change. Strategies for PBS, or positive behavior support. We're going to ensure that the strategies and the measurements we're using are clear for the child, positively stated expectation, reinforcement systems that are meaningful to the child, prevention strategies, movement, sensory, choice and breaks, replacement behavior, what to do instead. So giving that child something else to do. If we want them to stop, hitting or doing something that could be causing harm to themselves and others, try to replace that behavior. So keeping our expectations clear and consistent, setting clear and consistent expectations help children with autism understand what behaviors are expected of them. Repeating and reinforcing these expectations allow children with autism to internalize behavioral norms more effectively. Positive reinforcement, praise, rewards, and other reinforcements should be used to encourage desired behaviors. I always like to give a note to be animated, be lively, keep it short, keep it simple, but always use your best loud and proud voice and always be animated. Identifying specific reinforcers that the child enjoys, like a favorite toy, activity, or snack, with consent, of course, and providing these promptly when children exhibit positive behavior is critical to reinforcing those behaviors. Structured choices. Giving choices with a structured environment empowers children with autism and allows them some control over their activities. For example, asking or giving choice for coloring, reading a book, or a sensory toy. Giving that child agency and ownership with the choice making reduces frustration. We're going to model appropriate behaviors. Children with autism often benefit from seeing desired behaviors modeled by adults or peers, demonstrating how to act in specific situations, like sharing, waiting, can help children with autism understand and imitate positive social behaviors. Providing sensory support. Many children with autism have unique sensory needs, which can influence their behavior. So providing a sensory-friendly environment or access to sensory tools like fidget toys, noise-canceling headphones, weighted blankets can help children self-regulate and engage more positively. Positive behavior strategies not only promote desired behaviors, but also foster a more inclusive and understanding environment where children with autism can feel supported, safe, and motivated to succeed. Pairing yourself as reinforcement. So you should be associated with fun, with something exciting going to happen. So what pairing can mean? What pairing means is you are associated with positive experiences. The child or the student learns that when this adult is here, good things can happen. So the big idea with pairing is before students can listen or work with us, they must feel safe when working with us. So always using your loud and proud voice. Are you doing nice sitting? Good job. I love the way you're sitting. I love your calm body. So those are some examples of pairing myself with reinforcement, being animated, and always using a lively and proud voice when I'm working with my kiddos. So again, with this, the power of positive reinforcement, positive praise, celebrating everything, even those small things. It helps to ignore the behavior and not the child, ignoring that maladaptive behavior, or only giving praise when we're seeing the desired behaviors. So we're not ignoring the child, but we're not focusing on the maladaptive behavior solely, as in we're not giving attention to what we're trying to fade out, making everything a big deal. You're doing nice sitting, making it a big deal, making it immediate, giving that positive praise right after it happens or right after you see the child showing desired behaviors. And it's all in your tone. Again, make it animated or be animated if you must. Effective praise is immediate, it's specific, it's genuine, and it's focused on effort and skill. What we reinforce is what we see more of. Examples could be, you asked for help. Nice job asking for help. That was great problem solving. Nice sitting. I love your calm body. Rewrite. What you could do is maybe some phrases that you might be using now, make them more specific, be more animated, and make them timely. So bringing it all together, visual supports increase predictability, independence, and engagement when we're working with children with autism. Behavior is communication, not defiance. Everything the child is showing us is an attempt to communicate something. Positive behavior supports are proactive, inclusive, and effective for children with autism. Small changes in the environment and instruction can lead to big outcomes. Thank you again for participating today. Any questions, you can contact me. Again, my name is Dr. Emajonite Etienne. My email, etienneenrichment@gmail.com, is on the screen for your viewing, and my website is also here if you'd like to connect with me further. Thank you again to the Rutgers Office of University Online Education Services, the Rutgers Online Learning Conference, for allowing me to be here today to present at the 2026 Rutgers Online Learning Conference. Thank you all and have a great day.